Hi, I'm Dr. Larry Malerba. Welcome once again to the All Things Homeopathy Materia Medica series. Today I'll be discussing Arnica montana, the homeopathic remedy par excellence for all kinds of situations involving injury, trauma, and shock. Also known as leopard's bane or the mountain daisy, Arnica is a plant commonly found on European mountainsides. It's a member of the Asteraceae family. It always amazes me how such an innocent little wildflower can be such a powerful healing agent. All right, let's get started.
Okay, I want to begin with some word definitions. Contusion is the medical term for a bruise. A contusion is caused by an injury to the body that results in bleeding under the skin into the subcutaneous tissues, which in turn leads to the classic black and blue discoloration of those tissues. Another term for this leakage or extravasation of blood under the surface of the skin is ecchymosis. For all practical purposes, the terms bruising, contusion, black and blue, and ecchymosis are interchangeable. They mean pretty much the same thing. A hematoma is a larger accumulation of blood under the skin caused by physical trauma. Blood pools in a localized area, thus resulting in swelling or a firm lump under the skin. Now, there are many medical conditions that can cause bruising, but the most common cause is physical injury to the body. When bruising is associated with physical trauma, arnica is almost always the first remedy of choice. Arnica is the number one remedy for bumps, bruises, blows, falls, and injuries that lead to bruising. In fact, arnica is the first remedy to consider in almost all forms of physical trauma. Sometimes it can even be indicated for the chronic effects of severe physical trauma that occurred long ago in the distant past. In other words, arnica can fit people who have never been well since an old traumatic injury. Furthermore, as we'll see, it can also be a remedy for mental trauma. In addition to being the main remedy for bruising, arnica also fits the feeling or sensation of being bruised. The person who needs arnica tends to feel bruised and sore. The person or the injured part feels battered, sore, and beaten up. And either he does not want to be touched or he does not want the injured part to be touched. In such cases, arnica may be helpful even when there is no visible bruising. This can occur, for example, after overuse of the muscles or after a particularly vigorous workout, when the person feels achy and sore. Now let's talk about some of the conditions or situations where arnica can come in handy. We think of arnica in all forms of physical trauma, especially after blunt force trauma to soft tissues. This can occur, for example, after a fall or after being hit by a baseball or accidentally hitting a finger with a hammer. The resulting pain, inflammation, swelling, and black and blue discoloration point directly to arnica as the remedy of choice. In an ideal world, all school nurses' offices, construction companies, sports teams, medical clinics, and emergency rooms should be educated about the uses of arnica, and they should be required to have arnica on hand at all times. Furthermore, every surgeon should know how to use arnica post-operatively to reduce pain and bleeding and to help speed healing and recovery. In addition to blunt force trauma, arnica can also be used for sprains, strains, and bone fractures and injuries. Arnica should be given without delay for all head injuries, including concussions and traumatic brain injuries. In such cases, a few timely doses of arnica can reduce pain, promote healing, and prevent long-term complications. Arnica is also a remedy for blunt trauma to the eye, especially when the soft tissues surrounding the eye are involved, as is the case with a typical black eye. Of course, arnica and hypericum are the two most commonly recommended remedies to be taken after dental work. While arnica is aimed at damage done to the soft tissues of the mouth, hypericum is intended for injuries to the nerves. Use of these remedies often eliminates the need for conventional painkillers after dental fillings, extractions, and root canals. We also prescribe arnica for a variety of problems associated with labor and delivery. It can come in handy for the aches, pains, soreness, bruising, and bleeding associated with childbirth. Okay, before we move on, allow me to get on my soapbox for a moment. There are those who mistakenly think that homeopathic remedies can be used like some people use aspirin or antacids. They mistakenly believe that holistic treatments can do no harm. So they take various remedies, including potentized arnica, for every little ache, pain, sneeze, sniffle, bump, or bruise. In my opinion, this constitutes an improper use of homeopathy. The ideal is to allow the body to heal itself. So I do not recommend using oral arnica for mild symptomatology. The best option for minor bruising or muscular achiness is topical arnica. Topical arnica ointment or cream will do just fine in such situations. The bottom line is that all homeopathic remedies, including arnica, should be reserved only for when they are truly needed. All right, now let's talk about the arnica mental state. Okay, now, there's one particular arnica keynote mental clue that stands out above all others. And that is when a person says that nothing ails him, even though he is dangerously ill. This is expressed in the repertory under the rubric, says he is well when he is very sick. We're more likely to see this mental state in situations involving serious physical injury, or in states of physical or even mental shock. You may recall that opium has a similar tendency to be oblivious of the severity of his illness or his injury. This is one of the common features of mental and physical shock. The intensity of pain or severity of illness can alter the consciousness of the victim in such a way as to insulate him from the reality of his circumstance. Additional rubrics that demonstrate this idea include in delirium says he is well when he is sick, and delusion that he is well, and irritable sends the doctor away, says he is not sick. The patient appears to be in denial about his condition, but it's not really a voluntary state of mind because he's in shock. He's delirious or delusional, and he genuinely doesn't realize how much danger he's in or how sick he really is. Now, as I said, this state of mind can result from physical shock, which commonly occurs, for example, after a car accident or after a serious physical injury. But it can also be a consequence of mental shock. If severe enough, or if it hits him hard enough, this inability to understand the true nature of his condition can also result from a variety of psychological stressors. Arnica lists prominently under ailments from abuse, ailments from grief, ailments from fright, ailments from rage, and even ailments from financial loss. In all such cases, the patient is shocked, disoriented, and unaware of the seriousness of his own condition. He refuses help because he doesn't grasp the peril that he's in. Now, allow me to use the example of a head injury to talk about some additional arnica mental clues. Let's say that a soccer player has just sustained a concussion. She is semi-conscious. She fluctuates between conscious awareness and unconsciousness. When she rouses out of her stupor, she doesn't want to be touched. In fact, she doesn't even want to be approached. She warns people to stay away, assuring them that she is fine and that there is nothing wrong with her. She momentarily drifts off to sleep and then quickly rouses again when she's spoken to. She answers a few questions and then drifts off again. With time, she recovers only partially. She feels vaguely uncomfortable and sore all over. As her state becomes more chronic, she continues to carry with her the feeling that she does not want people to touch her or to approach her. She exhibits signs of depression, sinks into a state of apathetic indifference, and remains reluctant to talk to people. I paint this scenario so that you can see how an acute Arnica state can slowly and insidiously transition over time into a similar type of chronic state. And while a few doses of Arnica given immediately after a traumatic event can prevent a lot of suffering, if it's not given, it can still restore well-being months or even years later after the problem has become chronic. Okay, now let's talk about some generals and modalities. All right, now generally speaking, Arnica is the first remedy that we turn to in almost all cases of physical trauma. Arnica fits physical injuries resulting in black and blue bruising and the sensation of bruising or having been beaten up. Arnica tends to be sensitive to pain in general. A keynote clue is that the Arnica patient can be restless in bed and may change position frequently. But the reason for this is that he feels uncomfortable because he thinks that the pillow or the bed is too hard. This perception of the bed or pillow being too hard illustrates Arnica's sensitivity to pain and his aversion to being touched. In terms of temperature, the head is hot and the body is cold. Sometimes the upper half of the body is hot while the lower half is cold. This can occur especially when fever is involved. The nose or tip of the nose can also be cold. Arnica discharges can have a foul odor like rotten eggs. This putrid smell can apply to stool, flatulence, perspiration, and even breath. Another interesting keynote is that Arnica skin eruptions are often symmetrical, appearing in the same places on both left and right sides of the body. Notable Arnica fears include a fear of pain, fear of being injured, and the fear of being touched. In addition, there can be a fear of animals and the fear of death while experiencing heart symptoms. Okay, now in terms of modalities, as we've seen, Arnica is worse from touch. Arnica is both averse to being approached and worse from being approached because he's afraid of being touched. Additional pain-related modalities include worse from exertion, worse from overuse, worse from jarring, worse from motion, and worse from lying on the painful part. Temperature-wise, Arnica symptoms can be a mixed bag. They can be worse from cold damp, or worse from becoming heated, or better from cold bathing, or worse from uncovering. Arnica can be ameliorated by lying with the head low, but symptoms are aggravated from sleep in general. A couple more interesting symptoms include nosebleeds from washing the face and nosebleeds from coughing. Of course, there may be nosebleeds after physical trauma too. And lastly, a useful keynote clue is coughing that is associated with crying or made worse by crying. We may see this in children's coughs, in whooping cough, in bronchitis, and even in pneumonia. And now let's finish up with a few more Arnica conditions that can result from trauma. Arnica can fit cases of arthritis that develop after an injury. Symptoms typically consist of soreness and stiffness that are worse from touch and worse from cold damp. Arnica can fit bladder retention after injuries, after surgery, or after catheterization. Arnica is also a remedy for painful cases of acne. It can even fit skin conditions that develop after injuries. And remember that Arnica skin eruptions are often symmetrical. We think of Arnica in cases of pneumothorax that occur after injury. And it may be useful in cases of angina that are aggravated by exertion. It can also help muscular and vascular injuries associated with heart attacks and strokes. Lastly, Arnica can be startled from sleep or frightened by nightmares after having experienced an accident or traumatic event. Now let me leave you with one last example designed to show how an acute Arnica state can morph over time into a chronic Arnica state. A hypothetical young woman was violently raped, and she sustained a great deal of both physical and psychological trauma. If given soon afterwards, Arnica could have prevented a lot of suffering. But she did not receive Arnica, and 20 years later, she still complains of being sensitive to pain in general and to having an aversion to being touched. In fact, she says that her body still feels sore and achy all over. And when asked to describe it, she says that she feels beaten up. Granted, this is a fictitious case, but the true power of homeopathy rests in the fact that even 20 years later, Arnica would still have the ability to release this poor woman from her chronic state of physical and mental pain. Okay, now it's time for remedy relationships. Now, different sources list different complements for Arnica. Some of those complements include aconite, bryonia, rustox, and hypericum. Remedies worth comparing to Arnica include aconite, which is also one of the first remedies that we think of in cases of trauma, especially psychological trauma. Bellis perennis is considered to be the arnica of the internal organs, especially the female pelvic organs. It too is a great remedy for labor and delivery. Baptisia can feel bruised and sore all over, is stuporous and confused, and similarly complains that the bed feels too hard. Calendula is the best suited remedy for injuries that involve broken skin, like cuts and scrapes. I note this because topical arnica should not be applied to broken skin. You may recall that chamomilla is very pain sensitive and has a similar rotten egg smell to its discharges. Ledum is an injury remedy that fits later stage bruising that has turned yellow-green in color. Hamamelis also has a sore, bruised sensation and weakness of the veins that can lead to seeping of blood into subcutaneous tissues, like in the case of varicose veins. Opium is another serious trauma remedy that is associated with altered states of consciousness. Ruta is also indicated for injuries from overuse that result in pain and stiffness. Rustox is restless due to pain and discomfort and has a need for frequent changes of position. And lastly, although some call aconite the arnica of the eye, I think symphytum is more befitting of that title. While arnica fits blunt trauma to the tissues surrounding the eye, symphytum fits blunt trauma to the eyeball itself. I once witnessed a person get accidentally hit directly in the eye. There was a great deal of pain, and upon examination, something that resembled an air bubble had formed under the surface in the pigmented area of the eyeball itself. Symphytum was administered without delay. The pain improved almost immediately, and when I examined the eye a few minutes later, to my amazement, the air bubble was completely gone. Okie doke. I hope you learned something new from this discussion of Arnica montana. Please share, like, and subscribe, and I always appreciate your comments. Together, we can make this channel one of the best resources for homeopathic learning in cyberspace. Thanks for watching the All Things Homeopathy channel. And until next time, may the vital force be with you.